So prophetic.
Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am Jocelyn Turner. So happy to be here tonight. Today started off rather weird for me, but I won't tell you about that. I don't want to bore anybody about my issues. Now, Dr. Kane, being his usual self, won't take that. He'll probe and ask me, so what was going on with you this morning? But we'll talk about that offline, Dr. Kane. How are you doing this evening?
I'm doing fine. So what was going on with you this morning?
You don't get to ask me that right now, Dr. Kane.
All right. No, I'm doing absolutely fine. I'm happy to have my colleagues, my distinguished colleagues online with me. We will. She's not an AKA. She's just known as. You're not an AKA, right?
Neither one of us are.
Also
I'm talking
known
about
as.
me.
We are me, five me.
Both of us.
Yes, I am very happy to have my colleagues with me and Dr. Janique Bennett and Dr. Zalika Nisbeth, right? Did I say that correct?
Yes,
Right.
yes.
Okay. I wasn't sure if Miss Turner had a chance to make sure that she was going to be able to say it correctly, so I took off the hook. And if anybody screwed it up, I would.
Well, I was going to do that next, but since you beat me to the punch, good evening, Doctors Bennett and Nisbeth. How are you this evening?
We're doing well. I'm doing well.
Very well,
Wonderful,
thank
wonderful.
you.
Well, I'm excited to hear what you all are saying, and I'm going to go with what your on screen says, Dr. Z and Dr. I won't call you Dr. B, I'll call you Dr. Bennett.
Okay.
And listening to your for tonight, self advocacy, how to prepare for your medical visit. Now, transparency in years past, I prepared for my medical visit by calling Dr. Kane and saying, okay, so what should I ask? What should I do? But that's not the usual thing that we want to do. Years ago, someone gave my mother the advice for in terms of her preparing and managing her health, particularly as she started getting older, to get a tablet and start writing everything down in the tablet so that, as she changed doctors or went from one specialist to another, for example, she'd have everything handy. And I tell you what, that has been very critical and very useful for her. And she's actually told her friends how to do it, that they should do it as well, right? So it's really been a really good tool for her. But let's start out by talking what is it that our audience needs to know about self advocacy and preparing for their medical visit? Why did you all think that that topic was an important one for us to discuss tonight?
So I'll go ahead and take that. For me, with working in a traditional system like I had been previous 6 years, I saw the patient turnover in the clinic. So doctors are seeing patient after patient after patient, and you can tell the difference when a patient is truly prepared for their visit. They, like your mom, had everything written down. They knew their medicines. They may have known their specialist names or their diagnosis even, and that really helped the clinic or that encounter move forward through that whole time, and for us to get to a real crux of what's happening, what can I do next, what's the next steps, because of that preparation at the beginning of it. And so for me, it was very important to tackle this subject because we go to school for years upon years to learn how to be doctors, and no one ever teaches anybody how to be a patient.
Right.
And so for me, I was like, who's out there telling my patients how to be a patient and how to be a self advocate? Because we are their healthcare advocate, yes, but at the end of the day, after that visit is over, everything else is up to them.
Thank you, Dr. Bennett. Dr. Z, what about you?
This topic was and is important to me because just as Dr. Bennett has shared, you come across patients that don't, for me, my pet peeve has always been people don't know what they have or what diseases or what medications they're taking and why, and put the responsibility on me or us as the physicians to know. And it's when you act like when going down the medication list and asking, what are you taking? It's in the system, it's in the computer records. Well,
Guilty.
I know. We all don't have the same computer records.
you mean to tell me you don't know what you're putting in your mouth every day? And then
Nope. They don't.
understood how these computer systems work, or these electronic medical records work, the information is inaccurate. That's partly responsible for why there are a lot of preventable deaths, because medications are interacting that we, the physicians, don't know patients are taking, and the patients don't even know what they're taking as well. So our health, our individual health are really our responsibilities individually. And now it is time, as there are less healthcare providers, physicians are leaving, nurses are leaving, and more the population is growing and getting sicker. It's time to work together. It's a shared responsibility. So we're putting some work, putting the people to work.
Well, what's the top thing that you would say to someone then in order to be prepared so that they want? I mean, is the easiest answer to that question bring the list of medications that you're currently taking, or bring the actual bottles of medication to your appointment? What would be the first thing you would say to a patient?
So both are true. Bringing the medications are helpful because I can clearly see how often you should be taking. I can clearly see how many left in the bottle. I can clearly see when the last time you filled it. Because sometimes that 30-day supply was prescribed 90 days ago. It tells us a lot as a provider once you do bring those medications in. But even a list, like if I can get a list as a provider, that is enough. But at least be prepared to talk about, hey, this is what I'm taking. This is how often I'm taking it. I even ask my patients another specific question, like, how consistent are you on it? Are you 50% taking it, 75% taking it? Do you take it once or twice a week? Be honest. Because that's the only way I'm gonna be able to move forward through that appointment, even because if I don't have to increase this medicine, we can just focus on, okay, instead of 50%, how can we bump that up to 75%? Sometimes it's about talking to that patient about being consistent on the medication. And that's probably why it's not working. So yes, to that question, to the point of knowing your diagnoses, your medically given diagnoses, because that's another thing. Self-diagnosis is not a
Those Kmart doctors. I used to call them Kmart doctors.
You hear me? Oh, we have Google doctors now. We have Google MDs.
Google University.
Oh gosh, Google MDs here. That's self-diagnosing out there. So know at least your diagnosis. And if you do come in, this is a preparation on the acute side. Say you're feeling sick, right? Don't come in with a diagnosis. Oh, I have this. Because that actually takes away from time in that specific visit. Now the doctor has to talk about how it probably is not this for the next 10 minutes of this visit. Versus if you did give them a list of those symptoms that you're having. I'm having a headache. I'm having a cough. My left eye itching. They can actually make a true differential of your symptoms are for a diagnosis that's probably more likely the diagnosis that you have. So there's definitely things you can do to prepare for those type visits.
Real quick, the one that gets me the most, just to throw it in, is
Yeah.
All right. So, what's here for today? You should know. As if I'm Johnny Carson and psychic. I should know what. So, and that's the real answers a lot of times.
That is a real everyday answer. That's not just yes. Every day someone says that. And truthfully, even though, maybe two people have asked you, that front desk staff asked you, the MA has asked you, I will tell you, there's been instances that you get 3 different answers.
Yep.
I will talk to my MA as a kind of what we do. It's pre-round before that visit. And my MA told me something totally different than what the patient, when I asked that question, is. So do not be prepared, I should say. Be prepared to hear that question again and address that concern with the doctor at that time. You're right, Dr. Kane.
Dr.
But is
Bennett,
that, but is it,
before I leave, I just want to, you said your inmate, I just want to make sure people understand
Oh,
where are you working?
oh,
Not in my
okay.
office.
Okay, so I am currently a solo practitioner and owner of a firm, Direct Primary Care. I opened my practices, I opened my doors in November. My location is Jacksonville downtown. If
Okay.
you're not familiar with the model of direct primary care, it's a membership or subscription based model, meaning as far as payment goes, I don't use insurance. My members of my primary care practice pay $99 per month to get full service primary care services. So, yes, sir.
And Dr. Nesbitt.
wow, that's interesting, Dr. Bennett. But go ahead, Dr. Nisbeth. I'll get back to Dr. Bennett. Did you have something to add to that? What do
Oh,
you?
to add, yes, to add and put in my own plug for my own direct primary care practice, as well as laser hair removal boutique, Florida Peach Direct Primary Care servicing Jacksonville and Savannah as well. But to that question, to add to the, well, just to piggyback, it's again putting responsibility on the physician to know everything that's going on instead of just giving us the information so that we can be able to make the appropriate diagnosis to help. Because oftentimes the same question can be asked and you get a different answer because our human mind is fallible. We forget, and that's often why we know to ask the same question the same way or a different way to get the appropriate answer as well. Aside from medications and diagnoses, something else that is also important is no surgeries. We often ask, we want to know your medical history. Have you been hospitalized? What were you hospitalized for? How long were you there for? Have you recently been hospitalized? Because sometimes medications are changed during the hospital visit as well. And if we weren't there, we don't know. Oftentimes we don't get those medical records in time. So again, the importance of, if you can write down the list, write it down. If you're unable to, and it's easier to just bring the medication bottles, do so that we can keep the records up to date, as well as keeping your medical history up to date. Family history.
Yeah, so before we get past that, I wanted to ask you a quick question, because how would someone obtain a list if they don't remember, if they never wrote it down, but they've had different medical procedures or hospitalizations? Is there a portal somewhere that they can access if their doctor, for example, died or moved away? How would they find that list of surgeries?
I will say, oftentimes, if the person cannot remember having at least the year in which it happened and the hospital, if that practice does not have an electronic portal where you can log on and get that information, then you do have to pretty much, they are making patients pay for medical records. Why it's important to keep your own rolling list, because you can send a request to that actual facility or office for a copy of those records. But now they're making patients pay per page. They're You have to pay per page for your information. So if you have a portal, it will be best to log on and access that information. But if you didn't give that provider the accurate information, just know that the information that you do obtain from there will be limited, aside from any lab work or imaging like x-rays, CAT scans, EKG. That stuff will be there through that system. So that's where the importance of keeping your own documentation electronically at this point is helpful, on your phone or Google Doc. That way, no matter where you are, you can pull it up and access it. It's like a resume, honestly, updating it on your own, because relying on the each individual clinic or each individual hospital to have everything and keep it together is non-existent.
Can I tell you what happened with me? I had my when I think it was Dr. Bennett was talking about prescription medications, I actually had access to my pharmacy app, but I didn't want to take off my mask inside the practice during the COVID environment. And so it was at that point I said, I'm writing these things down. So I put them in the, because you have to use, I had my face as the way to open up the app, the extra
Mhm.
security on the app. So I actually put the names of my medications then on the notes within my phone. And then that way, you know what I mean? So I'm just mentioning that because to let people know you have to have more than one mechanism just in case the phone doesn't work, the the internet is unstable where you are. So I still believe that the importance of a hard copy. So in addition to having your list of medication, having your list of procedures, Dr. Nisbeth, you are about to mention knowing your family history. Throughout my career as a health educator, I've always shared that with people. People would do that family tree in preparation for those family reunions, and we would tell them put the diseases or health conditions that your family members had next to their names,
Mm.
particularly the living or deceased, because some families have health conditions that are rare, for example, and you'd want to know in further down the lineage if other relatives start to have some of those symptoms. So what would you say about that, Dr. Nisbet? Because I think you're about to say something about that, knowing your family history.
It's funny you say that because I just learned more about my own family history of epilepsy. Didn't know that at all. And rheumatoid arthritis, and that just came about through passing and conversation. And typically, I know in my family or culture, the you know diseases or chronic diseases, it's just not anything that's mentioned often. You just know someone had, if you even know someone has something, most people are just living with the disease, and not much is being said about how it's being managed or taken care of, or even understanding that multiple people in the family line have had it over the years. So it is important to know and have those conversations with your parents and grandparents about why are they taking certain medications, or what's going on with auntie or uncle that was sick in the hospital. Like, what do they have as well? We often don't ask those difficult conversations or bring that up. So family history does have an impact on our own individual and personal health. It helps the provider know what to screen for and look for, as well as risk factors to talk about, preventing things or early screening, especially breast cancer and colon cancer. I just got off a shift in Savannah, and there was so many people with colon cancer and breast cancer at young people. So that in itself is important, even if it's just knowing who in your family has cancer, who's had a stroke, who's had a heart attack, and at what age, so that you understand and know your risk factors, especially the immediate families, and immediate family members, meaning parents, meaning siblings, and first generation aunt and uncle and grandparents. So family history
Yeah,
does have
yeah,
an
it's
impact.
so important. It's so important, and you're right. People just, they don't think about it. Again, they'll make a lot of preparation for family reunions, not taken away from family reunions, of course, but you got to know your family health history in addition to, the names of, your maternal and your paternal family members. Dr. Bennett, what's the next thing you'd say that people should know or do to prepare for their visits?
Exactly. So I'm actually want to comment just a second on kind of the flip side of knowing your family history is
Mhm.
sometimes folks know, like, everybody in my family has diabetes. Everybody in my family has blood pressure, and it's kind of like they accept it.
Mm.
I really focus on, I guess, one of my passion projects in my career in ministry, I call it, is preventative care. So talking to the young and healthy, even to prevent conditions that run their family, prevent conditions that are associated with those type health conditions like diabetes and high blood pressure. But to your point about preparing, and kind of on the long lines with that, is preventative visits, right? Knowing how to prepare, not even necessarily prepare, because your preventative visit is a way to talk to your doctor at that visit about preparation, right? So that's one of the visits you may not even have to prepare for. Ideally, you go to your wellness visit one time a year. And yes, if you're an insured patient, typically this is a covered visit for you, as long as you don't talk about any other health issues. People are not familiar with that, because somebody coming there with their wellness visit and like, oh, my left foot hurt. You know what? This insurance is not going to pay for. It's a wellness check if your left foot hurt. Okay, so prepare to have a wellness preventative care, and it's known by many names: your annual physical, your wellness, your preventative care visit. All of those are the same thing. Okay,
Your checkup.
your checkup, your yearly. So whatever that is, it's a wellness visit, and again, it's free to you. So, but be prepared to go and say, hey, this is the year I'm going to do this, you know, based on your age, based on your sex, based on your genetic makeup and family history, just like we were talking about. That doctor should be preparing, okay, a list of things you need to do either this year or things to wait to next year for, and kind of putting that preventative list together for you. So that's that one way you can prepare for the year. And then out of that visit, you should be thinking as a patient, okay, so how often do I need to see this doctor, right? So, you know, a lot of people, for me, it's odd because I'm now in the direct primary care model, but a lot of people pay every paycheck to the insurance company. However, never see the doctor but once or twice a year.
Or at all.
Or not at all, right? And somehow it's too expensive to see the doctor, but they pay the insurance every paycheck. I don't get it, but okay. So, you know, you should say to yourself, how often do I need to go? Yes, I need to go for that yearly. If I'm a female, is it now my women's health yearly need to come up, right? Or if say I have a couple medications that I need refilled, should I be coming every 6 months? If maybe I have 3 or 4 medical conditions that I'm being monitored for and managed with treatments, maybe that should be every 3 months. Okay, so that preventative visit can tell us a lot and set up for the rest of the year. So yes, it's nice to do it at the beginning of the year, because you know it's just the starting point for everybody. But wherever you fail in during the year, it's possible that like, okay, starting point every few years. So that's one way to prepare, even knowing how often you need to go based on your own medical needs.
I recommend those annual visits to help one remember around your birthday. Just know when you're about to turn another year older, that it's time to get your body checked out, make sure things are functioning properly, and get your age appropriate screenings, because at certain ages, those are big years for starting breast cancer screening, cervical, which starts at 40 and maybe sooner, depending on family history. Cervical cancer screenings for women starting at age 21, as well as colon cancer screenings. Now that's changing to 45 instead of 50 as well for everyone also, but can be sooner depending on family history as well. Or immunizations also. Is it that age where is it time to get your booster for your tetanus, which is every 10 years? Is it time to start getting another flu shot, which we recommend once a year? Not certain about COVID, how often we'll get those, but also, is it time for your pneumonia vaccine at 65?
Or earlier.
Or
your medical needs.
So,
Let me ask a question, Dr. Nisbeth and Dr. Bennett, but let me first pause a moment and do a commercial. If you're just tuning in, we're talking to Dr. Z, or Dr. Zalika Nisbeth, and Dr. Janique Bennett, and we're talking about self-advocacy, preparing for your medical visit. If you have any questions for them, post it in the chat or dial in 888-669-1280. The question that I have, both of you mentioned direct primary care. So if I'm paying a flat fee of $99 a month, does that mean that I am only allowed the annual visit just as I am if I were coming to you with health insurance? Does it include if I hit my toe and I need to come in for you to look at it, if I have a cough and I need you to come in, that $99 a month or whatever your monthly is
Mhm.
from the individual, that will cover it and they won't have a copay. Can you explain how that works?
You're absolutely correct. Well, yes, for my current model and Dr. Bennett's, I believe, but I'll speak for myself and for most others. The monthly fee pretty much covers any most all of your visits. For me, it's all of the visits. Some providers have a cap on how many visits per month they will allow you to come without a copay, but essentially that membership fee is covering all of your visits. Sometimes labs are included, or either you have to pay an individual fee for a separate fee for labs. But pretty much for any of your primary care needs, you have direct access and communication with your physician. So if you have a cold, if you stubbed your toe and need it looked at, concerns for any infection, or just needing a physical or some lab work for a particular reason, then you can call or text or email your doctor. For me, it's 7 days a week between 10 and 6 p.m. And let me know what's going on, or your provider what's going on. Either you can come in and be seen in the office or a virtual visit, or again, you're on the phone talking and working out a plan for addressing that issue, which is different from the traditional model in which money is being paid directly to the insurance company, but you still have to find a physician and you still have to get into a clinic, and you are not picking up, you're not talking to that physician directly to schedule an appointment or address that issue. You do have to schedule an appointment and be seen either in office or either virtually, and depending on your insurance setup, there does sometimes come with a separate fee. So with direct primary care, the current model is automatic monthly payment, and that covers all visits throughout that month um, and year.
But do I still need insurance to cover the lab and hospitalization?
Not necessarily. If you already, well, for hospitalizations, and yes, I do recommend people having separate insurance for that, because those bills can be extremely high. If you have to go to the ER, the accidents happen, so you do need coverage for that. As far as labs and imaging, if you do have insurance, depending on the how much the insurance company covers, it could be helpful. For most practices, we do have our own contract with lab companies such as
Oh,
LabCorp, in which we have reduced fees where certain labs can be a dollar, between $1 and $5 that
okay.
we put off to the patient to pay. As far as imaging, that does it can be costly, and depending on contracts with imaging facilities, the where the patient direct cost to the patient can be reduced compared to what they charge the insurance company as well. So it really depends on your insurance policy as well as the contracts that are available with labs and imaging facilities. But you don't necessarily need insurance to for primary care. However, for emergencies and accidents outside of the primary care setting, absolutely.
Yeah, and I
Let
guess
me,
I'm thinking also of if you, for instance, if you know, and I've been open about my having diabetes. So I left my glucometer when I went out of town, and so I called my primary care doctor, and basically I went by the office and picked one up. So how would that work in this circumstance? Again, I'm just trying to understand whether or not direct primary care is an option for me, or and even just getting clarity as our viewers are watching and understanding, like, if that is that something. I mean, because Dr. Z and Dr. Bennett, you all are very sharp, and somebody may say, "Oh, I want to go to them." So I want to make sure that people understand how direct primary care works.
Let me play a devil's advocate for a quick second to help with that answer, Mrs. Turtle.
Dr.
Um,
Turner is fine.
well, so I'm not going to comment on that. Anyway, a couple of things. When it comes, I just want to make sure people, direct care. We want to make sure people understand that a lot of times it may be more additive to your current insurance. It's almost like guaranteed and is simple, but it's still somewhat complex. A lot of times, you got your own primary care. You can go to them. But as we all know, not all doctors are good doctors. Not, truth be told, and sometimes you may not even get the chance to talk to the doctor at all. And without uh, 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 dissing other healthcare providers, non-physician healthcare providers, you may not ever see your doctor except maybe the first time, and after that, it may be a PA or nurse practitioner take care of it. What direct to primary care for me, direct care means somewhat to me is that you all actually got your own consultant specialist that when you because you still make work for FedEx and have insurance, but you may not be able to get to see some of these people ain't got office available appointments for 3-4 months, and when it is, you got to remember like what we initially started out. When you first go in that office, they may be looking at 15 minutes, and they start the clock, and as you're talking, they never look up, and they're just typing on their computer or whatever. Okay, they walk in with a laptop. That means you're not getting 100% of their attention. They are trying to document what is going on. I'm not blaming them for anything because that's the way the system has been set up for years. And so people like these two young ladies, Dr. Elizabeth and Dr. Bennett, um, they are coming along and they're kind of filling in that gap to where you got your own expert on your side, not looking at just what your insurance company is saying or or following that protocol as dictated by a hospital or some other third party that doesn't have your best interest in mind. These two young ladies are saying that they have your best interest in mind. They're going to give you the based on what all of the knowledge that they have on how these whatever particular situation it is should be handled, whether it's preventive care, whether it's a particular issue that's going on, bad thyroid, whatever it might be. They aren't giving you that expertise. So you paying a little extra monies to have in your corner an expert. Okay. It's kind of like being the offensive coach for a football team. Yeah, you got an overall coach, but the guy that's going to specialize in taking care of your job as a quarterback or whatever, that is the person that you're going to rely on to give you the best advice. I know I simplified that quite a bit, but I was trying not to oversimplify.
No, Dr. Kane, I think that was perfect. You actually hit on several points I wanted to mention. We talked about the wellness visit. I tell my patients I am their health advocate. So similar to what you're saying, Dr. Kane, like I'm your personal health advocate at this point. Like you're a self advocate and you have support advocates all in your corner. I'm your health advocate. I'm using my knowledge, you're right, to the best of my ability to help you move along with your own health journey. So my patient wellness, we say wellness visit. My patients have an ongoing wellness program, essentially. Every visit we discuss their overall well-being, right? Because they have access to me for these reasons. And you're right, I get patients from all over. Majority of my patients right now still have private insurance, but you're right, they're choosing to have a doctor, a personalized, independent or individualized technique like we're using in a direct primary care model. I do have, and I honestly love to support those that also fall in that gap that needs care. My small business owners where, they don't really qualify for any of the Medicare or Medicaid type services because of their income. but also would pay really hefty fees if they were to try to use individual insurance. So these are people who are out here working in our communities and servicing our communities in many different ways. Our hairdressers, our nail techs, you know what I mean? These are people that are servicing, however, do not qualify for that employee type of benefits like health insurance. Another thing I want to talk about as far as frequency, you're right. I just spoke to one of my my colleagues, I should say, that works for a health system, and she was telling me her next patient or new patient appointment isn't until July. You know, to try to establish with her, you will be waiting months to see her.
Regardless of how good she is.
Exactly. And that's probably maybe the reason she's great. And that's why everybody wants to go see her. However, she just does not have the time. So direct primary care allows the physician really to decide how big you want your practice. It's really, built on how small or how big you want to have your practice, how many people you feel you can safely and effectively serve in this field, and you can make that number up to whomever. So for my practice, I'm choosing to have a small panel, one that I know I can effectively treat and continue to care for them on a wellness basis, be able to be accessible to them for acute care needs, be able to have a same day or next day type of appointment, be able to respond back to my email. So it's a choice about how many patients you want to have, not necessarily that hospital policy describing how many patients are going to be in my panel, how many patients I need to see per day in order to meet their model. So it's really giving more honest and more responsibility and more choices to the provider to make that choice for themselves, basically.
Mm-hmm.
So if you're just tuning in, we're talking about direct patient care, direct primary care. Which is it? I don't want to botch it up, ladies.
It's direct primary care.
Direct primary care. If
Yeah.
you have any questions of Dr. Nisbeth or Dr. Bennett, dial in now, 888-669-1280. One of the things that you were talking about, and I know so many people who are hairstylists or nail techs or mechanics, and people simply who are self-employed over the years have never had health insurance. Only time they go and see a doctor, quite frankly, is when they are just, about to fall out and end up in the ER or what have you. So I see how this could be a viable option for them. They can't afford health insurance, but they might be able to afford, and what was mentioned earlier by one of you is $99 a month. I mean, and I don't want to bash anybody, but a lot of people will go and get their hair and nails and that kind of stuff done a month. And I'm not hating, okay? But we have to put value on our health as well, right? And so
Health
to
is
me,
wealth.
right. And so
Say,
to
Dr. Smith,
me,
I missed it. What'd you say?
Health
health
is
is wealth.
wealth.
Yeah, and so I see that this is a good option for people to consider. So if you don't know anything about direct primary care, give Dr. Bennett or Dr. Nisbeth a call, and we're going to include their information on our website. But I do want to continue the discussion talking about self-advocacy. We talked about when you're going to the doctor, taking your medication, knowing your family health history, knowing your surgery or procedures you've had in the past. What else do patients need to do in order to co-manage, as one of you said, their health?
I will add to this. I think it was mentioned before, but I actually want to specifically hit this one on the head about transitioning care, about hospital. We call it hospital follow-up on the primary care side. So when you're leaving the hospital for whatever reason, say your blood pressure elevated and you end up going to the hospital staying the night, they may have needed to titrate your medicine. Make sure you're following up with your primary care doctor at that time too, whether you have the records or not. Usually the primary care facilities will then request them, maybe a little late, but at least they'll have them in their record. But when you're switching between doctors, a good rule of thumb for me that I use or try, especially as I'm moving to this new venture, I tell my patients, hey, have either a exit interview, essentially, maybe with your old primary care, especially say you're moving from Virginia to Florida or something like that, and you're going to see your primary care in Virginia that last time. Have an exit interview. Ask them to print out and put them in your hand, your last two encounters. That's going to have your diagnosis in it. That's going to have your surgical history that you explain to that physician. That's going to have your medications in it. Bring them to that doctor's office. Because a lot of times out here, like, oh, I told the doctor to send you. You ain't get those? I didn't. I didn't.
What you're saying is basically they give you a summary of your medical history.
Yeah, at least in those two last encounters. They may be over a year of time frame. That's a lot of information for a new doctor to retrieve, especially if you're switching between doctors. It's a basically summary of your medical care thus far in that old clinic. That's a technique you can use.
You guys said something earlier. I just want to make sure I throw it out there. When, in terms of patients having to pay for their medical records and so on and so on. What I want patients to remember, to know by law, they have to, if I get a new patient coming in and I need those medical records by law, those doctors have to forward it to me and you don't have to pay a dime.
You don't.
Okay. It's only when you want your own personal copy of all your medical records, it's when you may be charged for getting that. But if it's just to move forward to another physician, like these ladies, if it's moved forward to another physician, there's no charge in it by law. You have to just forward it to their new provider. But if you want to take it and get a printout or a disc or whatever it is that you want, however it is, electronic, records of, like I said, disc or thumb drive or whatever it may be. If you want to do that, then yeah, they may charge you for that type of stuff. But
I tell you what, Dr. Kane, on that note, I tell you what happened with me. My doctor actually retired during the pandemic.
Mm-hmm.
And I had to, put on my intelligent hat, like, OMG, what do I do? Right. Because, and I remember the group that she was with. So I called the group, was not at the location, but because she was a part of this big group, I called, and I had been going to her probably about 15 years. And I was so happy, Dr. Kane, that I did not have to pay for 15 years of records, because it just so happened at that particular time, I was able to get those documents for a good reason. In terms of I had no idea that she was retiring, right? And so anyway, I digress. I just wanted to mention that. But what it did for me with the new doctor, knowing that doctors nowadays use patient portals, I can now see those 15 years of information that I shared with that other doctor, because it's now in the new practices patient portal. And I was like, oh yeah, I did get my that's when I got my tetanus. It's time for another one. That's when I had, you know what I mean? So you all are really hitting the nail on the head in terms of the importance.
What you want to remember, Ms. Turner, is that as primary care providers, we're supposed to be the gatekeepers. But in order to be a gatekeeper, you got to know what happened here, there, and everywhere. So all the information needs to come into our office. We house it. Okay. Now that don't mean we're going to print out everything somebody else did, but at least I got it. Okay.
Right.
So that's why we encourage patients when they go see their specialist, make sure they send me a copy of their medical records of what they did, because now I've got it housed in my medical records. And instead of having to go to this specialist and get it, and that specialist and get it, and that specialist and get it, these young ladies have all that information at their disposal when those the rules are followed and the suggestions that they have in terms of asking the patients to help us. You come in for that self-advocacy on how to maintain your health. And when they start saying, we need to get all your medical records and see where you're at. So write down all the doctors you've seen, because then every doctor that you've seen, we can now request those medical records. They become a part of your medical records within our office. And we can take a much bigger, broader look at you as a person, as an individual, than the cardiologist or the surgeon, the cardiologist who may just say, oh, that's the person that had AFib, and not know about the rest of your history. Or the surgeon says, I took her gallbladder out and they're done with it because they removed the gallbladder. And that's the extent of what they had to do. They're saying that as primary care providers, direct care providers, they can look and try to look at the totality of the patient, give you expert advice on what to do, how to do it, when to do it. Not necessarily saying they know it all, but at least give you that advice on it. I have patients all the time. Dr. Ken, I know you're not his patient, but my son or my daughter, and I offer it up for free. That's blowing the business for these young ladies because they need to send their son and daughter over there to talk to her. Which the first thing I tell them is, okay, I give you this little piece, but you need to have them go see somebody. If they don't have the money for insurance, go see somebody who they can pay for the advice, and they will probably. And at one point, I gotta say this because you mentioned it earlier. At one point, they can help you obtain some of these tests at a lower cost. As an example, real quick, I remember years back when I worked for this hospital, the wife had some some coffee intake that had glass in it. Okay. And wound up we had to do MRIs of the chest and the abdomen and the pelvis. Okay, just to see where everything was at, any bleeding, yada yada yada. When you set up for that MRIs, just the abdomen and the pelvis at that time, and that's cheap compared to today. At that time, they were $6,000 a piece. Okay, that's what they charge the insurance company. Pick up the phone, call one of these local standalone facilities, and ask them how much would this cost, and they're saying, "Oh, XYZ." I say, "No, no, no, no. This is a cash paying patient." They said, "Oh, $500." Now there's a big difference between 12,000. Okay, I don't care if it was $2,000 they had to pay. That was a big difference between 12,000 and so on and so on and so on. And even the person that had the insurance, their copay on that 12,000, right, was still $2,400. Okay, as an example. And these young ladies know how to navigate those waters as well as myself in terms of other primary care and people that are advocates for your health. Mm-hmm. They know how to navigate those waters and go, nope, I might work. Well, let me put it this way. Some of them work for certain institutions and they want you to send all the referrals into them. No, there's an independence provided by the consultants that you have, and they're going to try to look out for your best interest in terms of monies, but still make sure they do a good job that they were providing. If they're suck, I use the word, if they're a suck institution, a facility, why would I want to send them to that? So they don't do good MRIs, so I'm going to send you somebody else that do good MRIs and still cost effective.
So what other advice? We're almost at the end of the show. Not quite, but I wanted to make sure that and I see your finger, Dr. Nisbet. I want to make sure that we, allow you to share more advice to our audience as we talk about self-advocacy. Go ahead, Dr. Z.
At the bare minimum, if you are taking medications, please know why you're taking it. That's a good place to start. So that you know you have, whether it's one blood pressure medicine that you take, or whether it's two different blood pressure medications, or one diabetic medication or a cholesterol medication. Please at least know why you are taking these pills.
It sounds like you're finding people who don't know.
No, really? And it helps with understanding the knowing what diseases people have. So some people don't know that they have high cholesterol, but have been taking the statin, which is a type of cholesterol medication, for years. Some people don't know, the job of the part of educating people on the disease and why you're starting a certain medication. There's been a gap for many years. And there are my generation and maybe those that came a little bit before are having to clean up this mess of having to educate people on helping them understand you're taking this medication because of X, Y, and Z. We need to screen for or check these levels ever so often as well. But at the bare minimum, know why you're taking these pills. Know what you're putting into your body at the bare minimum. So
Mhm.
if you can't see what's on the bottle or your writing isn't clear, just bring it in so we can go over it with you. At the bare minimum, always know what medications you are taking. Another thing, vaccinations. That's also important. If you can remember, at least remember if you've had your flu vaccine or if you've had your tetanus shot, or as well, or when that's helpful, and cancer screenings also. So when did you have a mammogram, or when did you have your last pap smear? But we can start with, what medications are you taking? That's a
Yeah,
great
I
place.
don't even think adults know that they should take a tetanus. Once adults stop taking the childhood vaccines, other than hearing about influenza and now COVID, I
Mhm.
don't know if they realize the importance of taking a tetanus
Yeah.
vaccine. Can one of you share why that's important?
Yeah. So I
And
honestly,
speak to Tdap as well.
the Tdap.
Yeah.
Exactly. So for two reasons, as far as the tetanus, which Tdap is the tetanus and pertussis vaccine part of that. So it's funny because that vaccine kind of runs out right around the time where people stop coming to the doctor, right? You get it around 11 and 12. It lasts for 10 years. And now we're expecting our 21 and 22-year-olds to come in for their boosters. It's like almost the worst time. But yes, the tetanus vaccine is an important vaccine. Of course, we give it to kids, a part of their childhood vaccines, but it's honestly a very important. It's so we know we're Floridians. We love our flip flops. We probably love going outside without our shoes on all the time, right?
Mhm.
So those rusty nails that sometimes we get accustomed to, or maybe running across our grandmama carpet, and them nails coming through the carpet a little bit, that rust that comes on it, right? That can lead to bacteria in our blood that cause tetanus, that can cause muscle tightening and things like that. So we vaccinate against that quite often, and you can see why it's important in kiddos because they always hurting themselves. But the pertussis part of the Tdap vaccine is really to protect our newborns and our elderly population. It's from a cough that can cause us to have respiratory issues and be pretty severe, especially in our newborns. I think it's one of the leading causes in sudden infant death syndrome, if I'm not mistaken. It's definitely something that we check for if we get concerned about a child's respiratory status or blue babies and things like that.
Whooping cough.
Whooping cough, yeah, the
Yeah.
whooping cough. Yes, I said pertussis. Sorry, it is also known as the whooping cough, colloquially. So yes, so that's the important reason why we take it. We give it to mothers who are still pregnant because that's actually one of the vaccines that crosses over the placenta and gives some protection to the baby. And we ask that all adults who are in a household with a newborn infant also get the tetanus or Tdap, particularly for that whooping cough part about it. Yes. Yes,
Thank
Marissa.
you. And years ago, I was in an auto accident, and the keys cut my leg. And the
Mm,
first thing the hospital asked me, I was transported to the hospital, asked me is, when was the last time you had a tetanus? Well, working at the health department, they made sure that we were always up to date on that. But now that we're having a conversation, I'll make sure that I check my records to see when was the last time I had the tetanus vaccine. So we're
Wait a
at
minute, Dr.
the
Nesbitt
end
had
of the.
something she was looked like she was speaking to. Go ahead, Doc.
Well, I was brushing my hair back, but I'm
Oh,
just going to add that labs. Understand your labs. At least know if your lab work is normal,
Oh,
what
that's a
they're
big one.
testing for, especially kidney function. We've talked about diabetes and high blood pressure, but kidney disease, chronic kidney disease, is another chronic disease that is running rampant through our community as well. So understanding, ask questions. If you don't understand what the doctor is saying, or if you don't understand your labs, if you don't understand your medicine, say so. It is a part of our job to make sure you understand. It doesn't matter what we say. If you don't understand, it almost doesn't matter, because there's work. You have to do the work outside of the visit.
I give all my patients a copy of a copy of their lab. My staff goes, "You keep printing that. You know it costs money to print that out." It's like, yeah, but I give them the lab. I may comment on there what it means,
mhm.
and then those who are astute enough to look at it before they get to me, a lot of times I have a question. What does this absolute lymphocyte mean? Absolutely nothing. But again, they at least ask. And I went on ahead and explained it to them.
Well, this is great discussion, Dr. Z and Dr. Bennett. I mean, when we were talking about the show initially at the beginning, Dr. Kane and I always brief on the show, and I was like, now, what are they talking about tonight, right? But oh my God, this was absolutely amazing. And I definitely can see the value of you coming back. And I actually got a text before the show as, asking if I wanted another physician to join us, not necessarily on this discussion. When I shared the flyer, it's a friend of yours, Dr. Bennett. I'll tell you after the show. I won't put the person on blast. But anywho, great discussion, self advocacy, being a co manager of your health, so very important. At the end of the show, we like to give our guests, as you know, since you've been on here before, the their final thoughts for tonight's topic, knowing very well that we're probably going to have you back yet again. So you don't have to give all your knowledge in the last few minutes of the show. But Dr. Z, what are your final thoughts regarding tonight's topic?
Health is wealth, and your health is your responsibility. So, and ask questions.
That's it, huh?
That's
That's
a
it in
great
a
start.
nutshell. Yeah, great start. Great information tonight. Thank you, Dr. Z. Dr. Bennett, what are your final thoughts regarding tonight's topic?
So I would definitely, encourage those out there to interview your doctors. I think we may have talked about this a little bit, but sometimes we don't even have a choice who that health advocate is. Making sure that you choose your health advocate as well as you're being a self advocate, right? That's going to be the true path to healthy living and healthy outcomes in general, that you trust the word of the doctor that you are receiving, and following those instructions and feeling, having solace in what they're saying is right for you. If you don't trust that provider, like, or you don't listen to that provider, if you don't understand what they're saying, maybe because sometimes it's a language barrier, sometimes it's just cultural barrier, and you're just seeing that doctor because they're in your insurance card. I would not accept that for your own health. So that's also about being a self advocate, having, awareness enough to know, like, this doctor patient relationship is not going to behoove me. So get in a relationship that actually works for you, and do all the other things that we mentioned. I think Dr. Z was totally correct about at least knowing the medications that you're taking and why you're taking them. That will go above and beyond in your own health goals. So yes, ma'am.
Thank you, Dr. Bennett. Dr. Kane, what are your final thoughts regarding tonight's topic?
I won't be long winded, but I will say this. Um, Dr. Bennett just mentioned, culture barrier. That is a huge issue because when you're on these uh, employer insured plans, a lot of times you don't have option of who you can choose. Somebody you can relate to. I'm not trying to bash anybody else, but a lot of times you can relate to somebody who look like you. Okay. Now there are times that I don't want to talk to them at all because of other issues, but in general, a lot of times you're talking to somebody that look like you and understand the culture from whence you come, especially if it's the same culture from whence they come. Okay. The last thing is, I want people to remember that being a physician is like being Inspector Clouseau. We're always looking for clues to help us solve the problems that you may have. Okay. But in addition, we also want to prevent you from having those problems any problems associated with that, and or developing an extended version of that problem. Okay, whatever it may be, obesity, high blood pressure, cholesterol, you name it. Just go down the line, and we're really trying to advocate that. Give us the opportunity to find out exactly what is going on with you by providing us as much information as possible. If you do that, then you should have a very symbiotic relationship with your physician, And I'm not gonna say life gonna be peaches and cream, but we'll get closer to that peaches bowl of peaches and cream. So
Thank you, Dr. Kane. One of the things that I'd like to for us to talk about in the future show, because a lot of people who are listening may be young adults. They may not have diabetes or high blood pressure or high cholesterol. However, it is still important that they go in and see a physician, not just to take their children or to drop grandma or grandpa off. I would like for us to talk about that in the future and what is the value of a younger adult obtaining direct patient primary care. How is it adding value to them to remain a healthy adult?
Oh my
If
gosh.
you are just tuning in, or if you didn't hear the wonderful discussion tonight, the doctors gave some valuable tips. If you miss the show, it will become available online. We like to clean it up a bit. Our back behind the scenes guy, Tyrone, he'll clean it up a bit and make sure that all of my ums and ahs may be eliminated. But seriously, it will be available. Please share it with your family and friends because it's so important that we become managers of our own health. And the advice that the doctors gave was wonderful in terms of knowing what medication you're on and why, knowing your family health history. When you're going to the doctor, make sure you take your list of medications or preferably take the bottles of medication with you so that they can see exactly what you're taking, how much you're taking. And again, those are just a few snippets of what was discussed tonight. Stay tuned next week as we talk about what's really going on and why, and sharing more good information, not only for you, but for your family. And remember, if you have not gotten your COVID vaccine or booster, please make sure that you do so, and also your pneumonia and influenza vaccines. Take care, have a good evening, and good
and
night.
and remember, physicians are partners in your health. That's what we are, partners in your health.
Mhm.
Thank you, Dr. Kane. Thank you, Dr. Nisbet, and thank you, Dr. Bennett.
Good night.
Thank
Bye.
you.